Okay, hello everybody, and thank you for joining us today. My name is Dr. Leslie Hammer, and I'm the Associate Director of Applied Research and a professor in the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University. And I'm really thrilled to be here today with you and to be sharing this webinar with you. I want to also mention that I am a proud director of the Oregon Healthy Workforce Center, which is a total worker health center of excellence that's funded by the National Institute for Occupational Safety and Health. And what we do is very important work in terms of conducting research on hazards within the workplace, both physical and psychosocial hazards, as well as conducting more outreach to workplaces and education around occupational safety, health, and well-being. And so I'm happy to really welcome you today to the Working Well webinar series. And this is a bi-monthly webinar series that highlights unique challenges impacting workers in Oregon and beyond. The series is designed to help safety professionals, HR professionals, policymakers, and experts in occupational safety, health, and well-being stay informed of the latest trends and important activities in the world of work. May next month is Mental Health Awareness Month, and we're bringing to you today's session in an effort to inspire you to think about what you might do in terms of focusing on mental health in the workplace during the month of May and beyond. Recordings of this session, as well as all of our other Working Well sessions, are available on our website. And Portland State University Occupational Health Psychology graduate training program, also funded by the National Institute for Occupational Safety and Health, is a proud co-sponsor of today's event. And we'd like to thank them for their leadership in this area. So I'd like to go ahead and note a few housekeeping items. First of all, please feel free to use the chat feature to post questions that you have. We'll have time for questions a little bit in between and speakers, and then at the end, we'll have an open panel session for questions led by our Portland State partner. If you wish to chat with other participants or share resources with one another, please use the chat feature. And then participants will be muted during this webinar. On the left side of your screen, you will find a closed caption button as well. And we want to also remind you that those who wish to receive Society for Human Resource Management credit for today's session can do so, and we'll provide that information at the end of today's session. Next slide, please. And this just tells you a little bit more about the mission of the Oregon Institute of Occupational Health Sciences at OHSU. And as I stated, the Institute is our overall research institute, and our center, Oregon Healthy Workforce Center, sits within our institute. The institute is really dedicated to the health and safety of workers, and we are focusing on promoting wellness and preventing disease and disability in the workplace. Next slide, please. So just to bring us together on this topic today, what I wanted to remind folks of or introduce to folks is that mental health conditions are really affecting all of us in one way or another, directly or indirectly. And what that means is that the world of work needs to be paying more attention to supporting and really making the workplace a even opportunity for everybody, and supportive of people with mental health challenges, because many of us will either are experiencing or will experience in the future a mental health challenge or be affected by one. We know that 1 in 5 people in the US will experience a mental health challenge, and that 1 in 3 will be diagnosed with a mental illness. And that 1 in 5 have reported that their mental health has worsened since the pandemic. And so what that really means is that everybody is going to be impacted, whether it's yourself, your colleague, your supervisor, your family member, your friend. We're all impacted. And we want to normalize the fact that we are all impacted and from time to time do experience various levels of mental health challenges. And that means that we want to make the workplace more accepting and accommodating. Next slide, please. And the reason is because the workplace is also one of the causes of these challenges. So we take a social determinant of health approach and really understanding that both our mental and our physical health are impacted by many factors. And those factors can be both internally as well as external to us. And a number of those factors in our environment can have a significant effect on our experiences and our mental health and our well-being. And employment, as you can see, is one of those critical factors. And the work that I have done over my whole career has been to identify and understand ways that we can really change the workplace environment to better support workers' psychological health and well-being. And there are ways that we can do that. And today is an opportunity to learn more about that. Next slide, please. So reducing workplace risk factors and promoting a positive workplace culture of support can improve employee mental health and well-being. And we have the opportunity to learn more about some of those examples today. Next slide. So today's speakers are really going to be providing us some examples from their own workplace. We'll begin by learning about some of the work being done to support mental health from Captain Christian Rathke, who's with the National Environmental Satellite Data and Information Services, or NEDSIS. And then we will learn about some of the work being done at Oregon Health and Science University through the wellness program that is being led by Dr. Megan Furnari. Let me first spend a little bit of time introducing the two speakers, and then I'm going to turn it over to our speakers. So first of all, Christian Rathke serves as the director of NEDSIS, the Total Worker Health Program, which is within the national, within NOAA, National Oceanographic and Atmospheric Administration, which aims to protect physical and mental health of the workforce. The NEDSIS Total Worker Health Program aims to protect the physical and mental health of the workforce and advance well-being by transforming organizational approaches to daily work to create sustained and measurable health conditions. He was commissioned in December 2011 in the Commission Corps of the U.S. Public Health Service after serving for 7 years in the U.S. Navy. Captain Rathke is also an aerospace physiologist, a dive medical officer, and an educator. And he served as an instruction for the U.S. Naval Flight Surgeon course. Through the U.S. Public Health Service, he has been trained in public health crisis management and has been deployed to respond to public health emergencies. Our second speaker is Dr. Megan Furnari. She is the Associate Chief Wellness Officer for Oregon Health and Science University, and she's also an Associate Professor in the Department of Pediatrics. She brings a decade of leadership experience in well-being for leaders, staff, and faculty in academic healthcare, as well as specialized training specifically in women's leadership development. She's passionate about systems health and understanding how to create an impactful well-being transformation in alignment with the broader OHSU goals. And her focus within well-being specifically is on how to build sustained programs and strategic priorities that incorporate well-being best practices across the organization. So at this time, I'd like to invite Christian to please go and you can load up your slides.
Great, thank you. I appreciate that, Dr. Hammer, and what a great honor to be here and participate with the Working Well program. And let me just say, I'm a big fan of your research, Dr. Hammer, and the people you work with. Just really profound research. So thank you, and I'll be touching on that a little bit on how we incorporate your work there at OHSU as well. So I'm going to go ahead and share my slide here. And we'll kick off. And Leslie, if you could give me a verbal that you can see that, that'd be great.
Look great.
Great,
Yes.
awesome. So the in this small segment here, first let me just say these slides are designed really to double one as a presenting resource, but also I've given the PDF file to the leadership team there at OHSU to be able to distribute as a PDF as a resource as well. So there's a little bit more information on some of these slides than I'll cover in great detail. Just think of this as really kind of a high level brief, talking about how we really very purposefully engineer healthier work, specifically what our approaches are to psychological sustainability within our workforce. I'm a PHS, Public Health Service Commission Corps officer, assigned to NOAA, as Dr. Hammer had said, and as a medical officer. We cover a number of different topics, but about 3 years ago, we started a total worker health program, and we'll talk about how that really integrates and how we've integrated this psychological sustainability approach into and woven it into our program pretty deeply. So NESDIS, what does that stand for? You'll hear that acronym or see the acronym NESDIS. That's the National Environmental Satellite Data and Information System. What we do is we design and build satellites. We launch them either on a SpaceX or a NASA rocket. Then we fly those satellites. We bring all that data down from those satellites from multiple different orbits in space. We process all that data and we create over 900 products and services from that. We also archive all that. We've been using AI for well over a decade, and our supercomputers are where we store all of that to do weather forecasting and a number of other type of forecasting activities based off of the information that we archive within NESDIS. And so very, very technical workforce. The very large percentage of our workforce require a doctorate. Over 40% of our workforce require a master's to even qualify for a position. So highly technical, highly educated workforce, just so you understand the environment with which these applications are applied. So what is total worker health? There's a great affiliate program. If you're not a part of the NIOSH affiliate program, I'd recommend it. NIOSH is going through some reorg uh, uh, changes right now. We're not really sure where that's going to land specifically, but another really wonderful society is the Total Worker Health Society. There's a big seminar, symposium this fall. Highly recommend that you go to that. That's where I really was introduced to total worker health, the concepts of total worker health, and a lot of the contacts I gained from going to that symposium in 2017 are people that I still stay in contact with today. And then, of course, our program that we started 3 years ago, just to kind of surmise that. So to understand total worker health and understand our approaches to psychological sustainability, you really have to understand the really core tenets of the approach that we're taking. And that is the concept that work is a key social determinant of health. And what do I mean by that? Well, in the medical sense, when we think of social determinant of health, we're talking about non-medical factors that are linked to and influence health outcomes specifically. And so you see here on the chart, economic stability, neighborhood, physical environment, education, food, etc. Here, work really influences all of these things to a really large extent. Oftentimes we think, I circled there, community and social context. We think of work, and a lot of times work interventions are focused more on that specifically within the workplace itself. But overall, work really truly does influence a big portion of our health and health outcomes, even longevity, how many years we live. But one thing's for certain is that no examination of health is complete without accounting for the role of work. When we think about, since we're focused on this psychological sustainability within the workplace itself, one thing is for certain is that poorly designed work has significant um, uh, mental health consequences. And so just a couple things here. When we look at poor work design and how that ties into depression and anxiety. Things like working 11 hours or more per day, individuals were 2.5 times more likely to experience major depressive episodes. Another example, job strain accounts for about 17% of depression in working women and 13% in men. And then we also see really significant cognitive declines associated with prolonged working hours as well. So work and the way work is designed, the way we work in the modern work design or the modern way that human beings work now has significant both physical and mental health outcomes. Not only just the way work is designed, but we also see outside influences affecting the mental health of our workforce as well. And so for us, as we research climate and our climate scientists that we have within our agency here, this is an article published in the Journal of Nature in 2023. And what we see here is out of the 468 respondents, 39% said that they had experienced online harassment or abuse. And I would take that even a step further. We have climate scientists where they've received letters where people were really upset about some sort of piece of research, or they didn't appreciate the climate research that was being done, and letters saying that to our employees, saying they know where their family lives and they know where their children go to school. Just really, truly threats towards our workforce. And these have significant both physical and mental consequences. Particularly, you see here anxiety levels really increase. That makes sense if you're being threatened or harassed. Loss of productivity, sleep problems, depression, social isolation. So pressures and psychological pressures in particular don't always have to come from internal in terms of relation to work, but they can become from external factors inward on your workforce as well. So in terms of the way we at Nestis approach that, we really started out when we designed this program under the premise that individual well-being interventions really don't fix systemic work problems. And that's been proven over and over again for years, particularly within the federal workforce through like employee assistance programs and so forth. They simply just don't transform our organizations. They're great for individuals that are in crisis, but they don't transform a lot of the causative factors that are leading to poor health outcomes for our workforce. That's the reason for this total worker health approach. So what this really is, and so in the way we design this program is about 80% of what we do is totally systems focused. Only 20% is services to employees. So 80% is systems focused. And what we're really talking about are these approaches to safety, health, and well-being really being operationally integrated. Part of people's day-to-day work and everything that we do, no matter what level within the organization we're talking about, practices, procedures, policies, et cetera. We're really trying to bake it into the system itself here. And there's a number of advantages to that, which I've outlined here for you. There's not time. We could spend the entire time talking about how we design this program specifically, but if I were to just really summarize it for you in terms of the approach, the systems level approach that we have at Nestis for our total worker health program, it's really this interlinking cycle we've created here. And that's this link between organizational performance, work design, and employee well-being. These things we see as very much integrated and very much the way we define total worker health and our practical application of total worker health within our workforce. So we do a lot of internal research. We've done a fair amount in the last 3 years of research of really trying to figure out how work design is affecting the health outcomes of our workforce. And through that research, we've identified a number of things here on the left that are predominant things that we have identified as a prominent risk. And then on the right here, as a result of that research, we've defined a number of measurable outcomes that we wanted to see for our workforce. And there's about 20 different initiatives to achieve these outcomes that are currently underway right now. But you see here that I've highlighted this: ensure all supervisors complete mental health training. You don't see mental health deficits on the left side as a risk, but we definitely see these all integrated. And I'll explain why this is a predominant outcome that we've listed for our organization and why this is so critical and how we tie this all together. And that's what you see here in this slide here, where we really connect. I wanted to give you a visual of how we connect work design, psychological sustainability, and employee behavioral modification. So those of you that might be researchers, you probably heard of the concept in literature of nudging, and particularly at a governmental level, this concept of nudging and putting nudging type of principles within policies to get a population to change behavior on something. I really don't like the term because it's not descriptive enough, and so I use the more explicit term of employee behavioral modification. That's really what we're after here. And so what you see here is I've connected the work design element like autonomy to the psychological benefit, which it enhances motivation and reduces learned helplessness. And I connected a number of things here, not all of them, but a number of things here, the work design elements with the psychological benefit. But really the process that we're after here is on the right-hand side. And this behavioral modification process, as we see, is really essential. And that is that work design shapes psychological sustainability, enables our employee behavior, drives the change, the transformative change, which ultimately leads to the system level transformation. So that's the process, and this is the integration, and how we see psychological benefits as well as this behavioral modification integral to our whole work design approach and this systems level change that we're implementing. To do that, we also wanted to make sure that we took care of immediate crisis and things that are happening right now. And so in a partnership with OHSU, we had integrated their workforce, their workplace mental health training for supervisors. I believe they labeled it as mental health training for managers. We just relabeled it a little bit, but the program is phenomenal. What's nice is it didn't take any medical provider on our part to deliver it to our workforce. It's asynchronous training. It's really, really well done. The feedback has been amazing from all of our managers. We made it and implemented it as a mandatory training. And we've found a number of other uses for it already. We've only implemented it for a year. During the aftermath of Hurricane Helene, we had about 250 employees in Asheville, North Carolina, that were really suffering. There was a lot of strife, and when we went down there for intervention to work with that workforce, many of the supervisors and executives that were there said, "Hey, Captain Rathke, I think we're going to retake that course, that mental health training for supervisors course. It was so good, and there's so much strife right now. They did this on their own initiative, by the way. We think we're going to just retake that training because it was so good." In addition to that, we went ahead and implemented and opened it up to the entire workforce there, and there was a tremendous amount of positive feedback. Even though it was designed for supervisors, our workforce gained a lot of benefit for this. So this has been a critical tool for us in educating our workforce on the topic of it. It's also been on the topic of mental health, and it's been a great resource for us to destigmatize and normalize the conversation around mental health as we start to implement these work design changes as well. So a really wonderful tool for us to do that. This slide is quick. I just wanted to give you an idea of the way we brief when I speak to my fellow executives, the 15 executives I work with on a daily basis. This is a brief that I was giving them for 2025. Again, just really showing you the way that we brief or started out to brief the initiatives for 2025. You see mental health training number 4 there for supervisors as a key initiative, even though it's already been deployed for a year. It's a key tenet for what we want to do each year. You see that we provide timelines for workforce behavior modifications, and we outline those as well as work design changes, and then and then we're very deliberate and intentional in our integration strategies for embedding total worker health into daily operations. So the framework that we use and the framework we found most suited our workforce the best is this smart work design. This is out of research out of really Sharon Parker, Dr. Parker out of Australia, really wonderful research, very mature product. And that's this smart work design. So we use this as just a framework for our work design modeling. Again, we see as we design work with an intentional approach that this psychological sustainability, when we integrate that with smart work design framework, really has helped us create a science-informed blueprint for designing work that really protects both the mental health and supports resilience and sustains high performance over time. So again, we're using those tools that we have and those psychological sustainability tenets and purposely designing that into daily work at every level that defines work for our organization: policies, practices, procedures, etc., culture. To define that out a little bit further and tie each of these things into each of these smart work design tenets into psychosocial hazards. There you can see how that's kind of mapped out there a little bit. While we're teaching our workforce on the entire concept of smart work design, we're focusing really just on two tenets this year: the relational aspect and tolerance aspect. So the relational aspect, first we had to, if we wanted to be very purposeful and intentional about fostering team cohesion and a sense of belonging within our workforce, we needed some sort of validated tool to do that. So we're using the belonging barometer to measure that within our workforce this year. And then you can see what the intention of that deployment is, and then what we're going to do with that here by actionable insights, collaborative productivity, building trust and resilience. Those are really our goals by measuring belonging and then creating those interventions based on those results. The second piece that we're focused on this year, as I get ready to close out for this segment, is the tolerable demand. So we're just now concluding 2 years of research, really in-depth analysis and research on the topic of burnout. Really unique type of research. I hope to be publishing that later this year. But just to give you a taste of what that looks like, and we see again this psychological sustainability tied into this and the topic of burnout. We see these very, very closely integrated. In this case here, the goal of the research, one of our interventions is meet with purpose. So one of the findings in terms of the top 3 business practices that are driving burnout within our organization, one of those was excessive and poorly managed meetings. And then we talk about the strategies there. We have a whole report on that, really detailed report. This will feed into the final publication and research publication that we'll do later on. We've created a number of tools just to give you an idea of what that looks like. So first off, we're auditing every single meeting, recurring meeting that is occurring within the organization. We have a checklist here of a meeting audit considerations. We also have a lexicon of different types of meetings so people understand and use the same language and even classifying what a meeting is for. And then we created a number of tools as well and checklists here that are unique to our organization of how do you prep for a meeting? If you own a meeting, how do you prep for a meeting? What does that look like? If you're in a meeting, you're a facilitator of a meeting, this is a checklist of expectations for that. And even if you're just attending a meeting, there's an expectation that people are held accountable to within the organization just to even attend a meeting. And that's the checklist that we have there. So this is our intervention to change a business practice, so you can just kind of see that process of how we alter business practices or alter work design to create better health outcomes for our people. So in closing, when you think about it, the concept that work design and psychological sustainability are integrated and have tremendous, and work itself has tremendous impacts on human health, both physical and mental. is really not that big of stretch of an imagination when you think of how many waking hours a human being is in a work environment. It's a lot. So for a federal employee, they average about 2,080 hours per year. For our senior executives, they're about 2,800 hours per year. So really, really a lot of hours when you think of about that in a year in terms of waking hours. And we see really clear ties in terms of research uh, to work, mental, and physical health. And so viewing work as a social determinant of health really empowers both individuals, but also organizations to achieve measurable improvements in health outcomes. My hope is, and where we see the science starting to progress, is that really understanding work as a social determinant of health really underscores the need for public health priorities and medical and behavioral health priorities nationally, really to uh, comprehensively address the link between work and health, because um, truly healthy work really does equate to a healthy life. Those things are inseparable, and my hope is that in the near future, that when you go to a medical provider or a psychologist or a social worker, that a major part of their history taking to determine what is really influencing your health will be what is your work environment like, and really dig deep into that, because those things absolutely are connected. So with that, I'll hand it over to you, Leslie. Thank you very much.
Matthew, thank you so much. That was fantastic. And I got to learn more about the application of the workplace mental health training, which I have not heard about. I'd like to invite Dr. Fernari to pull up, or actually, yes, for the slides to be pulled up. And what we are going to do, just letting everybody know that I'll provide a slide at the end that is a resource slide that will provide you a link to the workplace mental health training that Captain Rathke had discussed. And after Dr. Fernari's presentation, we will then have Dr. Jensine Palade Hatcher come together with our speakers and facilitate a Q&A session. So we will have about 10 minutes at the end to do that. And please feel free to enter questions into the chat now, and we will then review those during that session. And we'll also entertain the questions at that time. So at this point, I'm going to go off screen and let Dr. Fernari begin her presentation. Thank you.
Thank you so much, Dr. Hammer and Dr. Rathke. That was really informative. I am at OHSU in Portland, Oregon with Dr. Hammer and her teams, and I'm the Associate Chief Wellness Officer here. We started our team in 2020 during the COVID pandemic, and we have just gained momentum and increased our program portfolio since then. Just for background, we really are focusing on some similar themes to Dr. Rathke: psychological support. I like that psychological sustainability term, belonging and community building, and then meaning and purpose, professional fulfillment. As he said, work is a big part of our life. So let's be fulfilled and happy and enjoy it. Not always, but enough. And then just speaking to the OHSU well-being work, we focus on staff, faculty, and learners at OHSU, which is 22,000 people. I just pause there because some chief wellness officers across the country are just focusing on one portion of the population, maybe the physician workforce. And I just feel so lucky to be here and have the opportunity to think about everybody, because we all connect, we all impact each other, and we focus on all our missions as well. So the research mission, the clinical mission, and the education mission. So it's a holistic approach, and I think you can't do it any other way. We're all here because we believe in systems improvement, system support, and sustainability. So like-minded, and just wanted to put a little context here on the frame I'm going to bring to today's presentation. Next slide, please. So to further understand the work, I think just pausing on our mission and vision. for OHSU Wellbeing. And then I'm going to zoom into 2 specific areas of our programming and try to talk about them in a way that you all could take to wherever you're at in your organizations and scope and scale them to have impact is my goal. Because it matters right now. I think having models that you can use to help support your community, build effective relationships, supportive relationships is critical. So hopefully you'll leave with that or ask us questions on the panel so you can leave with that. So when OHSU started this well-being team, investing in well-being is such a big deal. And honestly, I wanted to zoom out to zoom in. Our team took this very seriously. I really wanted to do a strategic planning process for us. So if you are in an organization yourself and this is part of your portfolio or you want to do well-being related work, having a process matters and it allows you to create frameworks. I love that well-designed work emphasis in the prior presentation. So that applies to this work as well. Design matters, infrastructure matters. So creating that intention. I love that word. There was intention used a few times prior. I'm very supportive of that approach, and it's even in our mission statement. So we on my team got together and came up with this mission. And honestly, it's looking at how we bring the different isolated well-being efforts together and then creating some of our own based on what's needed. And that's the mission, to collaboratively improve the well-being of our community through intentional organization, implementation, evaluation. The evaluation piece is critical, and Dr. Rathke presented so many great outcomes and assessments and how they're checking and barometers. I love that, keeping things in a structure to really make maximal impact for everyone in our community here at OHSU. I also just wanted to name for the definition of well-being for you all from my lived experience, and everyone's a little different, is really the systems side of the well-being efforts. Thinking about culture and community improvement and systems efficiency is what I center in the work. I just wanted to say that because I think there are different perceptions around what well-being is within organizations. And of course, personal well-being is a big part of that. But often I think it's like, if you think about a gardening metaphor or analogy, like if you put a seed in really dry soil where the seed needs water and sun and it's dry and there's no light, you're not going to have a plant. And I think just thinking about that, a lot of folks in healthcare have so many great qualities. They're often very creative and smart and resilient, and they're put in environments where it's just impossible to grow or thrive. So next slide. Our aspirational goal as a team here, and my goal as a leader here, is to create that workplace where we have psychological sustainability, well-designed work, to quote from prior, where we all can thrive. And that, we have improvement to go. Those systems pieces take time, and the inefficiencies in addressing those and the redesign and the innovation all needs to happen. But that is my ultimate goal in this space. Next slide. So to get there takes a huge village. And I think the fact that OHSU is investing in a team to do this work, investing in myself to help build that infrastructure and that, well-designed workflow is incredible. And it's so much bigger than us. And I mean, I'm here with you all who are either probably really interested in this, and Dr. Rathke is a leader and Dr. Hammer is a leader. And together we try to move the micro movements. I heard you saying the word nudge, but it's those micro movements that make the macro movements forward. And I just wanted to name that no matter where each of you are operating from and your role in well-being, whether you're curious or doing some volunteer work within the organization, or if you have formal protected time, it's so critical. And finding the right fit for you and then building your network and your community partnerships really build this out. So Dr. Hammer asked me actually to pause and talk about how we work beyond our team and how we build that piece out, because I think it is critical for success. So I'm going to take us to the next slide. So this is our OHSU Wellbeing Collaborative. It is the group beyond my small team that we go to every other month and have a really rich meeting, discussion, learning opportunity around what's going on across the organization. And these folks in these pictures represent all different spaces. So there's folks coming from our DEIB space, human resources, from graduate medical education, from our different schools. We have a school of nursing, a school of dentistry, school of medicine, even a PA program. So we have a lot of different stakeholders here. So I think the frame to take home with you is like, where do you work? What do you want to do in well-being to create that space, that place where people can thrive together? And who are your partners here? And, who do you want to work with to represent many voices so that you're creating something that fits the organization and not just one group? Or you could focus on one group if you have limited resources and it's a really high-risk group. So, thinking about who and how. And what we do in this group is we come together every other month. And I usually have someone share on expertise. So kind of like today's webinar, they bring something forward that they're particularly passionate about in the well-being space, or maybe they went to a conference or national meeting and they want to bring a best practice back. We make time to elevate people's projects, events, opportunities, things they need help with in the meeting space so that there can be more growth across networks so people can share expertise. And then we pause usually at the end just for some, connection and reflection, which is more and more important in these times. We need to make sure we're building in space for people to feel connected and in community and have time to notice where they're at. And that's part of well-being too. So we've been super intentional in our space at cultivating this community. And honestly, the value is huge. A lot of our unique programs, which I'll talk about in a moment, have partners within this community that have either become a leader or a facilitator, a trainer in those programs, or they get the word out for us and really promote the work. So you need that mechanism to grow outward. And, the more people you can get to, the more of an impact we can have and the more community building occurs, which is really at the heart of all of this. I think when I think about programming and well-being, my biggest goal is, can we create an intentional space for people to come together and feel like they mean something in the space they're working, and that people are seeing that and really honoring that and honoring them. And I think that's what I'm trying to build when I think about a lot of these structures, whether it's our collaborative space or it's our program space. Go to the next slide, please. So I'm going to move from kind of one of the operational features of OHSU Wellbeing, our collaborative, which complements our own team efforts, to thinking about the programs in general. I'll go through what we're doing here and then zoom in on one of the programs that Dr. Hammer asked me to specifically focus on as a model that may fit your space as well. So I'll just say this, our programs, we source from kind of national best practices, other programs that look good and are working with good metrics, and then we take pieces of them and adapt them for OHSU. So everything we have here is fairly custom, which I feel really lucky to say. We've got great brains and thoughtful people at OHSU, which makes it fun to work here. And it's unique. And I think that's what it takes. Often you can find something really wonderful. And I heard this in the Leslie's mental health training for supervisors or managers. Dr. Rathke or Captain Rathke edited it slightly to fit his space. And honestly, it's been such a joy to see it growing at OHSU, and we've helped promote that for her more broadly. And I took the training and loved it. So there's just so many possibilities, and you can adapt where you can because everyone has unique needs. So I'm going to tell you about our programs that we've built internally and then zoom in a little bit, and then we'll go to our panel shortly. Next slide. So I told you about our focus areas. We have a program supporting leaders in the psychological support space. For building community, we have camaraderie groups, which I'll speak to in a minute. We do some seed grants to get local innovative projects going. We have some creative wellness workshops combining, art, reflection, sense of space in our hospital. And then we do meaning and purpose with some special rounds that are specific to the healthcare environment and talking about patient cases and impact on providers and staff. And then finally, we look at workplace efficiency and kind of mini systems issues we can handle on the local level. Next slide. So I'm just going to speak to camaraderie, and then I'll pause and we'll go to the panel questions and answers. So this is a program I started in 2023, just out of COVID. It's a virtual small group experience with 2 facilitators. We've done 5 cohorts since then in 28 small groups. and it's helped almost 300 people at OHSU. Go to the next slide. We did this because we were feeling like our workforce was feeling really separated and not connected, and community building wasn't great. And there were a lot of, rifts in teams, new teams. No one had worked in the same physical space. So we tried to build these groups to address that. And we had interprofessional groups and some profession-specific groups. 6 sessions, intentional prompts and ordering of those prompts over 3 months, 10 to 12 in a group. And I talk about the different cohorts and the types of groups. And then we're just finishing almost our 5th cohort, and we've looked at some higher risk groups who might need some intentional community building and want to move forward with that ongoing for the next cohort in fall. But these are our metrics, and we actually just had a publication accepted in Mayo Clinic Proceedings, and it'll be coming out soon. These small groups in this spacious place, and honestly, the facilitators hold the space. It's for generous listening. It's not for problem solving, which is really strange in healthcare. Increase people's sense of belonging, decrease stress, decrease some burnout metrics, and then increase the job satisfaction for some folks. So I feel like that's a really wonderful example of how you can build something simple and you can have huge impacts for people. And that's my goal here at OHSU. So next slide. This is just if you are curious or want to take some of these models home to you, whether the operational collaborative or the camaraderie groups, please reach out. I'm happy to chat more. Back to Dr. Hammer. Thank you so much.
Thank you very much, Megan. Appreciate that. And yes, it's been some fantastic work that you've been doing at OHSU, and I've been able to see that firsthand, and very much appreciate that work. So at this point, what I am going to do is turn it over to my colleague, Jensine Poletti-Hatcher, and she's going to facilitate a question and answer session. And we'd like to encourage those of you who, I think we'd like to be able to have the ability to take off mic. I'm not sure if we can, but I'd like to have the ability to take off mic in case people would like to ask questions. And then or you can ask questions in the chat. Dr. Poletti-Hatcher is an assistant professor of psychology at Portland State University, and she's been spearheading this session with me and with Amy Spring for the past 6 months. So I appreciate Jensine jumping in and now facilitating the questions. I see one in the chat, but I would like to know if Justin, is it okay for people to unmute as well if needed?
Yeah, they can just send me a message and then I'll get that unmuted on my end.
Send you a message. Okay.
Yeah.
Okay. I'm going to turn it over to Jensine.
Hey all, I've been monitoring the chat throughout, and it looks like we don't have any questions just yet. I think everybody is just taking in the fabulous talk still. But go ahead and raise your hand or message Justin if you do have any questions.
And there's actually one question. There is one question. And it's, I don't know the difference between Q&A and chat, so I don't know how I can see this now, but do you see the question in the Q&A, or I'm happy to read it?
Please go ahead. I
couldn't even explain to you the difference. Okay, Christian, this is a question directed for you, and it's from our colleague Marnie Dobson. And she said, I'll just read the whole comment. Thank you, Christian Rathke. Such an excellent example of how to apply total worker health and healthy work design in an organization. I wanted to know if you've been able to present your program findings to other federal agencies, or if you've had feedback or interest from other organizations about how to do this in their workplaces. How can we share your experiences more broadly?
Yeah, thank you for the really kind feedback. I appreciate that. Yes, we are currently working with 4 other agencies right now and implementing total worker health model that is modeled after the NESDIS approach to implementing total worker health. So we do work with other agencies. I've been consulted by a number of other agencies and helping them work on specific issues. So it's more of a targeted total worker health approach where they're really just focused on one major issue that's plagued their organization. But more than happy to talk further offline if you'd like. People reach out to me via LinkedIn all the time and ask questions. So happy to set up something if that's useful for your organization. But we worked with in the previous administration, we worked with the presidential management agenda pretty closely and in trying to implement a number of federal-wide workforce things. But you know, everything changes, everything's in cycles, and we just kind of go with where the need is, and if we can be useful to you, more than happy to help. But thank you for the great feedback. Appreciate it.
Wonderful. We do have one question. I'm going to just bounce to a question for Dr. Megan, and then we'll go back to a question for Captain Rathke. So could you give us some examples of prompts used to shape the camaraderie groups?
I sure can. I facilitate each time because I don't want to just lose touch with the space and understand the needs of folks. So we start with I can tell you the arc of the themes and maybe a couple prompts because that's how we do it. So the first one is on origin stories. Like a lot of the time we work together in these teams in healthcare and we don't know people's stories and we're doing really intense things for patients. I'm in the ICU, so I'm doing resuscitations and I may not know the story of the nurse next to me. And that's sad to me. I try to have those conversations in my workspaces, but in these intentional groups, we say, what brought you to healthcare? Or, we have practice managers right now in a cohort. So what brought you to practice management? And you get all these really beautiful stories. And we also do in that same class a community agreement, which I say in healthcare, we don't often pause and just say like, what do people need and like, where are we at right now? And a community agreement is a great way to do it. And if you've never done one, it's basically like, this is my version, what are your needs and what are your, intentions for today, and just put them out there, and we'll make a document and reflect on it and bring it up every time we meet and say, how do we edit for today? What's different this week, this month? Everything's changing so much in the world. It's so nice to create a centerpiece of like what we can hold together. And then we go on to like, purpose and passion, belonging and not belonging, cautious hope. And those prompts really center around values. How do you find purpose we have a transitions and challenge and change topic, and how do you handle those and how do they land in your space and what do you do? And it's great to see collective wisdom growing as people reflect, and no one kind of tells people or reacts to them. We just hold the space and listen, and it's just really rich. I hope that helps.
Thank you. Now back to a question for Captain Rathke. The current federal environment is particularly stressful for federal employees and higher education. Are you adjusting your programs as a result?
Yeah, um, I'm just being careful how I word word things. So yes, there are adjustments for sure. As we, but total worker health, as we designed it 3 years ago, was very, very closely integrated to operations. In fact, we consider ourselves an operational program, not an employee service program. And because of we're tied to operational business metrics, productivity, engagement, retention, those type of things. We were very integrated in those pieces. It's allowed us to continue on a lot of the research and things that we're doing, but still a lot of adjustment and certainly a lot of, for example, we're losing a lot of employees. And we created a 3-page resource document of if you suddenly lose your email, how do you integrate into free legal services, community, workman's comp, food banks for the DC region. I think we posted that. We gave it to our workforce. It was so well received. I thought, wow, as an HHS employee, there's a ton of agencies in HHS. Since we're losing 20,000 people in HHS, they clearly need it. So I posted it on LinkedIn over a week ago, just about a week ago, and there's over 30,000 people have interacted with that document, which just tells you how many people are in really desperate need. And so I think it would be tone deaf not to adjust our approaches and our focus to make sure that we're meeting people where they're at and the critical needs that they're experiencing right now. And so we definitely see that as a priority, but we also have to take care of our workforce that we have that's going under tremendous, that's trying to live through tremendous amount of reorganizational change, reorganizational or reorg change. That has a lot of change management challenge, but it has a human factors piece that's really critical as well. And so that I think total worker health in particular is well suited to handle that change management from a human factor standpoint. And we're definitely very focused on that. So yes, it's changed the context, but not necessarily the focus of what we're doing. But great question.
Wonderful. And in our last 3 minutes, I think we have one time for one last question to both of y'all. How do you get the attention of a supervisor or superior who doesn't get the value of well-being? As an example, they may say something like, "Enough with the touchy-feely, get back to work."
I can take some of that one. I think I want to spend time with that person and have a conversation and understand who they are, the supervisor. I don't know if that always works when there's a power dynamic. I'll say in my role, I would, if I heard that about someone who is pushing a lot of the well-being work away, I'd say I'd love to meet with them, because I found that you often can find out what people care about, what their values are. And then if you start there and then build from that point, you can tell a narrative that spins this in a way that very much aligns, because everybody cares about feeling good. And like at the end of the day, it's usually a shared want, need. So if you can ground in that and find the language that they speak and then build the argument from there, that works. If the person's their supervisor and they're trying to promote the work, that adds the power differential, which I think makes it a little more complicated. And maybe Captain Rathke, if you have some good advice there, it does change it. I'd say get some partnership, build the case, and they'll have to notice, because it's rare, very real right now that burnout and wellness is a priority. Yeah.
Yeah, I love that answer. I would add to that, in terms of our approach from a work design standpoint, work design happens in two directions. It's not unidirectional. First is top down and the other is bottom up. Top down is policies, procedures, and so forth. And the way we design our program is I sit as a co-equal executive with all our other executives. So I'm involved in every policy, every strategy, every tactical decision making, all budgetary decision making operationally, not medical, not support services. And so instead of trying to respond to things afterwards, I'm involved in add the human factors and make sure that I add the human factor component into all the operational decision making. That's the top down piece. The bottom up piece is what we call job crafting. And so that piece, when you're working from the bottom up and you're pushing up like that, is really important. So in an example of burnout, which I loved your example of burnout there, and the importance, emphasis, Megan, on that is so the way we do is we tell people, okay, you're overloaded, you're sensing burnout, and part of our burnout pilot, we use a NASA TLX test load index where we measure and teach people to structure their day based on perceived burnout and energy depletion at the end of the day. So they have actual scores. And then we tell them to empower them to have that discussion with their supervisor. We tell them to list all the things that they're doing, not just the things that are in a PD, but the 3 other hats that they're wearing, all the responsibilities they do in a week. And then they have a list of all these things that they're doing, and that empowers them to go to speak with their supervisor saying they're overloaded, but it also empowers their supervisor to be able to respond and then either distribute work somewhere else or change timelines. But it helps them understand, wow, I didn't realize, when you see it all listed out like that, it empowers the supervisor then to advocate for the employee who's saying they're overwhelmed or burned out. And so I think that kind of practical approach of empowering both the supervisor and the employee and giving them practical tools and approaches towards that really helps a lot.
Thank you so much. I'm just going to jump in and close us out, and very, very much appreciate both of the presenters. And I'd like to let everyone know we did show the code for the SHRM credit, and on the screen right now is a QR code to reach some of those workplace mental health trainings and other supervisor supportive trainings. And please take a minute. We will be sending out a quick 2-minute exit evaluation. If you can please keep your eyes open for that. And thank you so very much again. Jensine, thank you so much for also facilitating the discussion. And everybody take care and take care of your mental health. And actually, Justin, if you can go to the final slide, that would be appreciative. One more. Oh, got it. Okay. Thanks, everybody.